Hi, I'm Dr. Keith Berkowitz, and today I'm going to talk about a very common issue people develop with the digestive system known as small intestinal bacterial overgrowth. First, we want to talk about what foundation is. Foundation is the basis or principle for every illness. Typically in medicine, people treat reactively where they treat symptoms. A better way to look at it, or a more holistic way to look at it, is to treat from the bottom up, where you build a stronger foundation, allows the body actually to work better, and actually on its own and with help, solve more medical issues. So we look at today, a lot of people have issues with weight gain or an inability to lose weight. Two of the main principles which stand behind this are blood sugar regulation and digestive disorders. Today we're going to talk about digestive dysfunction. As I said before, we're going to talk about small intestinal bacterial overgrowth. Many individuals have this and don't even realize. People walk around with symptoms such as heartburn, gas and bloating, abdominal pain, nausea, feeling full too quickly, constipation, and don't know how to solve these problems. What we've learned is more and more people developing inappropriate growth of bacteria in the small intestine. If you look at the human body, in general, it's normal to have a large amount of bacteria in the colon, and this bacteria often produce gases. These two gases are methane and hydrogen. But when it comes to the small intestine, which is responsible for most absorption of nutrients and processing of food, it isn't normal. We actually have very little amount of bacteria. We have bacteria such as lactobacillus, bifidobacterium, and E. coli. But when these abnormal bacteria, often known as gram-negative bacteria, overgrow, they produce something called endotoxins. It is these endotoxins that cause this inflammation and cause issues with gas and bloating. It's through that production of both hydrogen and methane gas that this happens. So how common is this? If you look in the general population, it's as big as 20% of normal people without any medical issues. If you look at issues from hypothyroidism or an underactive thyroid, it's as high as 54%. Things like chronic fatigue syndrome, it could be up to 80%. Things like irritable bowel syndrome, ulcerative colitis, it could be, again, in the 80% range. And with people with obesity, it could be as high as 50%. So this is really important to look at ways to actually how to treat this almost epidemic new disorder called small intestinal bacterial overgrowth.